Welcome to Module 7. In this video, you will learn about distress. This is a hybrid learning curriculum for migrants. Let's get started. Introduction: Understanding distress. Distress is a state of emotional suffering. It can be caused by a variety of factors, including stress, trauma, and loss. It is important to understand the different types of distress and how to cope with them. Coping with distress. There are many different ways to cope with distress. Some people find it helpful to talk to a therapist or counselor. Others find relief in exercise, relaxation techniques, or spending time with loved ones. Module Objectives 1. Understanding distress. To understand the psychological distress experienced by refugees throughout different stages of displacement, including pre-flight, flight, and resettlement phases. 2. Contributing factors. To explore the socio-cultural, economic, and political factors contributing to refugee distress. 3. Mitigation strategies. To introduce evidence-based strategies and interventions aimed at mitigating refugee distress and promoting resilience. 4. Practical skills. To equip participants with practical skills for providing culturally sensitive and effective psychological support to refugee populations. Content Description 1. Importance of learning about refugees' psychological condition. This section aims to equip participants with the necessary knowledge and skills to provide culturally sensitive and effective support to refugee populations. 2. Importance of learning about refugees' barriers to inclusion. This section aims to equip participants with the necessary knowledge and skills to provide culturally sensitive and effective support to refugee populations. 3. Key message. In a module focusing on addressing refugee distress, learners will understand the critical importance of cultural sensitivity and humility in providing effective care. Distress and anxiety. What is distress? Distress is a state of emotional suffering typically characterized by symptoms such as anxiety, depression, and a feeling of being overwhelmed. It often results from adverse experiences or situations that challenge an individual's ability to cope. Distress can be caused by various factors including trauma, loss, uncertainty, and significant life changes. For refugees, distress may stem from their displacement, exposure to violence, separation from loved ones, and difficulties in adjusting to new environments. What is anxiety? Anxiety is a feeling of worry, nervousness, or unease about something with an uncertain outcome. It can be a normal reaction to stress, but when excessive, it can interfere with daily activities. Anxiety manifests through physical symptoms, such as increased heart rate, sweating, and trembling, and psychological symptoms, such as persistent worry, fear, and a sense of impending doom. In refugees, anxiety can be triggered by concerns about safety, future prospects, and adapting to a new culture. Dealing with a stress attack. Stress attacks can be very frightening, but they are not physically harmful. Understanding how to manage these attacks can help reduce their frequency and intensity. A stress attack, also known as a panic attack, is a sudden onset of intense fear or discomfort that peaks within minutes. It is often accompanied by physical and cognitive symptoms such as rapid heartbeat, sweating, shortness of breath, dizziness, and a feeling of losing control. Relaxation and mindfulness. What is relaxation? Definition. Relaxation refers to a state of being free from tension and anxiety. Techniques for relaxation help to calm the mind and body, reduce stress, and improve overall well-being. Relaxation techniques can include deep breathing, progressive muscle relaxation, and visualization. These techniques help individuals manage stress and enhance their ability to cope with difficult situations. What is mindfulness? Definition. Mindfulness is the practice of being fully present and engaged in the moment, aware of your thoughts and feelings without distraction or judgment. Mindfulness techniques include mindfulness meditation, mindful breathing, and body scanning. These practices help individuals focus on the present moment, reducing anxiety and increasing emotional regulation. Mindfulness and relaxation techniques. Deep breathing exercise. Find a quiet place, close your eyes, inhale for 4 counts, hold for 4 counts, exhale for 4 counts, repeat for 5 minutes. Progressive muscle relaxation. Tense and relax muscles from toes to face, focusing on the sensation of relaxation. Mindfulness meditation. Sit comfortably, focus on breathing, notice body sensations, and gently return focus to breathing if the mind wanders. Practice for 5 to 10 minutes. Psychoeducation on coping strategies, positive thinking, recognize negative thoughts, challenge their validity, and reframe them into positive ones. Problem solving. Identify the problem, brainstorm solutions, evaluate options, choose and implement the best solution, and reflect on the outcome. Seeking social support. Identify support people, communicate needs clearly, participate in community activities, and offer support to others. Cultural and recreational activities. Introduction to cultural and recreational activities. Connect with cultural heritage and the host community. Art therapy. Gather materials, create expressive artwork, and share in a supportive environment. Music therapy. Listen to various music genres, sing, play instruments, and discuss music as a tool for managing emotions and stress. Sports and physical activities. Choose an enjoyable activity, engage regularly for physical exercise benefits, and join group activities for social support. Communicating your distress issues. Step 1. Recognize and acknowledge your emotions. Recognizing and acknowledging your emotions means being aware of and accepting how you feel, rather than ignoring or denying your feelings. Step 2. Identify trusted individuals or resources. Trusted individuals or resources are people or services you feel safe and comfortable talking to about your distress. They could be family members, friends, community leaders, support groups, or mental health professionals. Step 3. Choose an appropriate time and place. Selecting the right time and place for a conversation about distress ensures privacy and minimizes interruptions, allowing for a focused and supportive discussion. Step 4. Use clear and simple language. Using clear and simple language helps others understand your feelings and needs without confusion. Avoid using overly complex terms or jargon. Step 5. Be honest and open. Being honest and open means sharing your true feelings and experiences without holding back. Authentic communication fosters trust and understanding. Step 6. Explain specific experiences and needs. Providing specific details about your experiences and what you need helps others understand how to support you effectively. Step 7. Use non-verbal communication. Non-verbal communication includes body language, facial expressions, and gestures that convey your emotions and reinforce your spoken words. Step 8. Ask for feedback and clarification. Asking for feedback and clarification ensures that the person you are speaking with understands your distress and can provide appropriate support. Step 9. Listen actively. Active listening means fully concentrating, understanding, responding, and remembering what the other person is saying. It shows respect and encourages a supportive dialogue. Activities with Facilitator 1. Role play. Participants will engage in role-playing scenarios that simulate real-life interactions with refugees. Through these scenarios, they will gain insight into the experiences and challenges faced by refugees, fostering empathy and understanding. 2. Brainstorming. Signs of the mental health impact of refugees. Participants will engage in brainstorming sessions to identify signs and symptoms of mental health problems commonly observed among refugees. This activity will help participants recognize potential mental health problems and understand the importance of early intervention and support. 3. Familiarity with mental health services. Participants will research and identify local resources and support services available to refugees in need of mental health support. Through this activity, they will gain insight into the barriers refugees face in accessing mental health services and explore strategies to address these barriers. Learning Activity 2. 1. Debate. Participants will engage in a structured debate on the economic impact of migration, exploring different viewpoints and considering the socio-economic factors influencing refugees' inclusion in host societies. 2. Brainstorming. Barriers to refugee inclusion. Participants will engage in brainstorming sessions to identify barriers to refugee inclusion in different sectors of society. Through this activity, they will gain a deeper understanding of the challenges refugees face in accessing essential services and participating fully in their new communities. 3. Recognition of successful migrants. Participants will explore and discuss notable migrant figures who have achieved success in various fields, emphasizing the positive contributions migrants make to their host communities. This activity will encourage participants to recognize the diverse talents and potential of refugee populations. Face-to-face workshop-based instruction. 1. Module 7 Distress. The module on distress is designed to provide comprehensive training for individuals who work with refugees, aiming to equip them with the necessary tools to recognize, understand, and address the various stresses and mental health challenges faced by this population. 2. Target audience. The module is intended for a broad audience that includes social workers, mental health professionals, volunteers, educators, and anyone involved in providing support to refugees. 3. Knowledge participants will gain an understanding of the unique stresses that affect refugees, including pre-migration, migration, and post-migration experiences. 4. Skills. Participants will develop practical skills to identify and assess signs of distress in refugees. 5. Attitude. The module aims to foster empathy, respect, and cultural sensitivity among participants. Understanding refugee distress session knowledge. Know the most common stresses and mental health challenges faced by refugees. Skills. Conduct basic mental health assessments and identify signs of distress. Attitude. Develop a respectful and empathetic approach towards refugees. This session focuses on understanding the mental health challenges faced by refugees. Participants will learn about common stressors and how to recognize signs of distress. They will also develop skills in conducting basic mental health assessments and providing immediate emotional support. The session emphasizes developing a respectful and empathetic approach towards refugees. Participants will be encouraged to reflect on their personal biases and their impact on providing support. This will foster an inclusive and supportive environment for sharing experiences and learning. Managing a stress attack. Step 1. Recognize the symptoms. Recognizing the symptoms of a stress attack can help you understand what is happening to your body and mind. Common symptoms: rapid heartbeat or palpitations, sweating or chills, shortness of breath or a feeling of choking, dizziness or lightheadedness, nausea or stomach pain, trembling or shaking. Step 2. Focus on your breathing. Controlled breathing can help calm your nervous system and reduce panic symptoms. Activity. 1. Sit or lie down in a comfortable position. 2. Close your eyes and take a deep breath in through your nose for a count of 4. 3. Hold your breath for a count of 4. 4. Exhale slowly through your mouth for a count of 4. 5. Repeat this breathing pattern until you feel more relaxed. Step 3. Use grounding techniques. Grounding techniques help you focus on the present moment and divert your mind from panic. Activity. 5 4 3 2 1 technique. 1. Look around and name 5 things you can see. 2. Name 4 things you can touch and touch them. 3. Name 3 things you can hear. 4. Name 2 things you can smell. 5. Name 1 thing you can taste. Step 4. Reassure yourself. Positive self-talk can help reduce the fear and anxiety associated with a stress attack. Activity 1. Remind yourself that the attack will pass and you are not in danger. 2. Repeat calming phrases such as, I am safe, this will pass, or I am in control. 3. Release the tension and focus on the relaxation. 4. Move up to your calves, thighs, abdomen, chest, arms, and face, tensing and then relaxing each muscle group. Step 5. Relax your muscles. Progressive muscle relaxation helps reduce physical tension. Activity 1. Start by tensing the muscles in your toes for 5 seconds. 2. Release the tension and focus on the relaxation. 3. Move up to your calves, thighs, abdomen, chest, arms, and face, tensing and then relaxing each muscle group. Step 6. Visualize a peaceful place. Visualization can help distract your mind from panic and induce calmness. Activity 1. Close your eyes and imagine a place where you feel safe and relaxed. 2. Focus on the details of this place, such as the sights, sounds, and smells. 3. Stay in this mental image until you feel more relaxed. Step 7. Seek professional help if needed. Professional support can provide additional tools and strategies to manage stress attacks. Activity 1. Consider talking to a mental health professional about your experiences. 2. Explore therapies such as cognitive behavioral therapy, CBT, which can help you understand and change thought patterns that trigger stress attacks. 3. Ask your doctor about medications that can help manage anxiety if necessary. Step 8. Practice regular self-care. Regular self-care can help reduce overall stress and the likelihood of stress attacks. Activity 1. Engage in regular physical activity such as walking, yoga, or any exercise you enjoy. 2. Maintain a healthy diet and get enough sleep. 3. Practice relaxation techniques like mindfulness, meditation, or deep breathing exercises regularly. 4. Stay connected with supportive friends and family. Session 1 Structure Activity 1. Discussion. An open and participatory discussion on key concepts such as distress, trauma, and their impact on mental health. Participants are introduced to basic psychological support strategies and discuss practical cases of individuals experiencing distress. Activity 2. Brainstorming. Participants discuss barriers migrants face when accessing mental health support and propose solutions. They identify strategies to overcome these barriers and summarize findings in plenary. Activity 3. Local support services. Participants divide into groups to identify local organizations and services offering mental health support. Each group prepares a presentation and shares their findings. Activity 4. Workshop Closing. Participants share their main conclusions and note down 5 major ideas they learned. The session concludes with a short questionnaire to assess basic understanding of distress among migrants. Session 2 Structure Activity 1. Discussion Impact of Trauma. The session focuses on the impact of trauma on migrants, particularly on mobility, employment, and access to services. Participants rate the impact of trauma on different aspects of life using a 1 to 3 scale, access to relevant websites. Activity 2. Cooperative Learning, Symptoms and Support Strategies. The session introduces and discusses psychological and physical symptoms of distress using case studies. Participants are divided into groups to discuss support strategies for different symptoms. Case studies, group discussion board. Activity 3. Importance of early intervention. The session shows a video and discusses the importance of early intervention and support. Participants discuss how early intervention can help mitigate the long-term effects of trauma. Video link, group discussion board. Activity 4. Workshop Closing. Participants share their main conclusions and note down 5 major ideas learned. The session concludes with a short questionnaire to assess understanding of distress, trauma, and support strategies. pens, note-taking materials, short questionnaire. Understanding refugee distress assessment questionnaire. 1. Trauma can have significant impacts on both mental and physical health, including changes in sleep, appetite, and emotional well-being. 2. Early intervention is crucial in addressing distress and trauma to prevent further harm and promote resilience. 3. Empathy, cultural sensitivity, and effective communication are essential in providing supportive care for distressed individuals. 4. Symptoms of distress can manifest in various ways, including changes in appetite, sleep patterns, and physical health. 5. Making appropriate referrals to support services is a key part of providing holistic care for distressed individuals. Let's review the correct answers to the assessment. 1. The correct answer is true. 2. The correct answer is false 3. The correct answer is true 4. The correct answer is true 5. The correct answer is true. We hope you got all the answers correct. Coping and emotional well-being self-assessment. Instructions. Answer each question honestly based on your experiences over the past 2 weeks. Use the scale provided to rate how often you have experienced each statement. Rating scale. 0 equals never. 1 equals rarely. 2 equals sometimes. 3 equals often. 4 equals always. Self-assessment. Questionnaire, emotional awareness and expression. I am aware of my emotions and can identify them easily. I feel comfortable expressing my emotions to others. I often reflect on my feelings to understand them better. Stress and anxiety management. I can manage my stress levels effectively. I use relaxation techniques to calm myself when feeling anxious. I find it easy to stay calm in stressful situations. Positive thinking. I challenge negative thoughts and replace them with positive ones. I focus on the positive aspects of situations, even when they are challenging. I maintain a hopeful outlook on life. Problem-solving skills. I can identify problems clearly and find solutions. I approach problems with a plan and evaluate different solutions. I feel confident in my ability to solve problems. Coping and emotional well-being self-assessment. Instructions. Answer each question honestly based on your experiences over the past 2 weeks. Use the scale provided to rate how often you have experienced each statement. Rating scale. 0 equals never. 1 equals rarely. 2 equals sometimes. 3 equals often. 4 equals always. Self-assessment. Questionnaire, social support and relationships. I have a strong support network of family, friends, or community members. I feel comfortable asking for help when I need it. I offer support to others and participate in community activities. Self-care and physical health. I take care of my physical health by eating well and exercising regularly. I make time for activities that I enjoy and that relax me. I prioritize getting enough rest and sleep. Adaptability and resilience. I adapt well to new situations and changes. I bounce back quickly from setbacks and difficulties. I feel resilient and capable of handling life's challenges. Seeking professional help. I know when to seek help from a mental health professional. I feel comfortable talking to a counselor or therapist if needed. I am aware of the mental health resources available to me. Conclusion. This module has provided you with a comprehensive overview of the concept of distress. You have learned about the different types of distress, the factors that contribute to distress, and the effects of distress on individuals and communities. You have also learned about the importance of recognizing and responding to distress in a compassionate and effective manner. We hope that this module has been helpful in expanding your understanding of distress. We encourage you to continue learning about this important topic and to apply the knowledge and skills you have gained to your work with refugees. Thank you for watching. The Health My project is co-funded by the European Union. Views and opinions expressed are, however, those of the authors only and do not necessarily reflect those of the European Union or the European Education and Culture Executive Agency. Neither the European Union nor the European Education and Culture Executive Agency can be held responsible for them.